Recording now.
Perfect. Well, good evening, everybody, and welcome to another edition of Ask the Doctor. Today, we're going to find out about how to reduce pain naturally, which sounds super awesome. We have the benefit of having a gentleman who teaches, trains, and lectures doctors all over the world, put in well over 10,000 hours, and an incredible family man, a mentor and friend, the incredible Dr. Bob Rakowski.
Well, Carol, thank you always, and happy, beautiful, amazing evening, all. Pain is certainly a topic that I'm very familiar with, as it's the top reason that people will visit any doctor anywhere. And there's a lot of misunderstanding about it. So I always thank you for the introduction. And I like to let people know that this is now my 31st year in clinical practice. I've seen all ends of the spectrum, the most elite patients on the planet, and people that were sent home to die. And very fortunately, some of those patients are still alive decades later. And I really enjoy teaching. So I have taught doctors on 6 different continents. And I've also taught seminars on pain and trauma and inflammation and how bodies can recover from it. So let's start with a very simple definition. So pain is an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage, or maybe we could even say life damage. So I really like that they threw an emotional there. And I let people know that there's lots of different types of pain. Physical pain is one that a lot of people identify with, but there's mental, physical, emotional, spiritual, social, financial, impactful pain. All areas of life can experience pain, but we're going to deal with the physical pain in this conversation tonight. And by the way, pain does have a purpose. So this is an X-ray of a foot that's about to be amputated. They call that a Charcot foot or a Charcot joint. That's how they pronounce that. And notice what it says. That develops as a result of neuropathy, a pathology of the nerves, which decreases sensation, in fact, to the point where they cannot feel pain. And therefore, just walking can destroy that limb. And that's what happens to the diabetic. And that's how they often damage their joints to the point where they need to be amputated. So one of my rules is friends do not let friends become diabetic. Pain can be a good sensation if it gets us away from behaviors that are harmful to us. So 4 major categories of pain. Nociceptive pain, that's going to be due to, as it says, noxious stimuli. It could be thermal, it could be pressure. It could even be due to tissue damage. Then there's going to be inflammatory pain. And someone asked me, what type of pain do I see in my practice most? Mostly inflammatory pain. And I'll even address a topic called silent inflammation, which might actually be worse than pain-causing inflammation. Neuropathic pain, that's a picture of shingles, which can be absolutely horrible. People feel like their nerve is on fire. And other forms of that. The diabetics can have neuropathic pain. So can people that have toxic neuropathic pain after things like chemotherapy. And then dysfunctional pain. There's a lot of that going on. And some of that can be conditions like fibromyalgia. So I show this chart of the top drugs used in the US because number 1 is actually for pain. So the top prescription is a combination of hydrocodone, which is, by the way, is an opioid, and acetaminophen, which a lot of people know as Tylenol. And so that drug has a lot of different downside. And again, number 1 prescribed drug in the world. And if I were to teach about drugs, I would show the pharmaceutical websites that show that if someone's taking a drug, the guideline is they should take the lowest dose for the shortest duration. So this medical study shows that prolonged use of opioids, that is the top prescribed drug in the US, has adverse consequences like tolerance. And what does tolerance mean? Instead of 1 pill getting it done, now you need 2, then you need 3, then you need 4, then you need 5. Abuse, addiction, hyperalgesia means that they become more sensitive to pain, hormonal effects, and even immune suppression. And I've lost patients to opioid addiction. I had a patient that I saw, I hadn't seen him for a period of time. And he married a younger woman. So he was in his mid 40s when he married his wife. She was in her mid 20s. And I asked him, well, her name was Stacy, so I'm not giving any confidentiality away. I said, so how's Stacy doing? And he looked at me, he said, she's dead. And I said, oh my God, what happened? He said, well, the opioids got her. She got hurt. They put her on these drugs. She was an instant addict. She couldn't break the addiction. So the addiction broke her. And that's horrible. I think that these drugs need to be restricted a whole lot more. And when I was doing COVID updates, what they know is that these opioids can be associated with the cytokine storm and death from the virus. This is a horrible statistic here, but opioid overdose per 100,000 people actually exceeds motor vehicle deaths per 100,000 people. So this is a big problem. And wouldn't it be nice if we could give these people natural solutions for pain? And then, by the way, if we start looking at overdoses, opioids being a top category, that went up nearly 40% with the pandemic. And there's a Dr. Scott Athlis, Stanford doc, brilliant individual. He said when they look at the policy deaths, that caused 25 times as much loss of life years than the virus itself, even with dramatically virus-inflated stats. If we look at Tylenol, which people take, or even the ibuprofen, those have downsides. But one of the things they found out is that Tylenol and alcohol don't mix. That can be really bad for the liver and or the kidneys and cause problems. And aspirin can be a problem as well. So this was actually a study out of Harvard. And when they were recommending aspirin for everybody, they said, look, if you're a man over the age of 70 taking an aspirin a day, there's a risk of GI bleeding or a hemorrhagic stroke. So you want to be careful about even things like aspirin. Now we'll get into the categories of pain. So nociceptive pain, that one's kind of obvious. If you hit your thumb with a hammer, you know what's causing that pain. And when people do have that type of pain, they know what's causing it. Now this one, I'll get to the concept of silent inflammation, but I did a license renewal seminar earlier in the year. And we were talking about chronic illness, and all of these on the right are chronic illnesses. So diabetes, non-alcoholic fatty liver disease, which by the way is associated with diabetes, cardiovascular cancer, depression, autoimmune, neurodegeneration. So we're talking Parkinson's, Alzheimer's, sarcopenia and osteoporosis, that's loss of muscle, loss of bone, and even suppression of the immune system. All of these things are consequences of systemic chronic inflammation. And inflammation is a source of pain. And when we break down the causes, notice they say chronic infections, physical inactivity, obesity, wrong balance of bugs in the gut, poor nutrition, stress, et cetera, and different toxins. All of these fall into the category of what I call the deadly quartet: stress, toxins, malnutrition, physical inactivity. So time cover story, the secret killer. The only time that inflammation is a secret killer is when it's below the threshold of pain. So I tell people, if you're having pain, you're better off, because that silent stuff is absolutely deadly. Later on, we'll talk about strategies for inflammation. And my favorite superfood, Ganoderma lucidum, modulates the inflammatory process by over a dozen known mechanisms with no downside. So we'll talk a little bit about more about that later. But when we look at the causes of inflammation and inflammatory pain, stress, toxins, malnutrition, physical inactivity, all of these things can cause the inflammatory process, chronic illness, chronic pain, and early death. So if we start looking at stress, this was even before the pandemic. They said that about 3/4 of all medical visits are in some form related to stress. And that, of course, spells bad things for our society. And probably the most powerful single protocol that I've used, maybe ever in clinical practice, is a stress reset. And if you've never done one, I'll encourage you to do it. I recommend melatonin, theanine, and Ganoderma spores specifically every waking hour. Melatonin puts the brakes on the adrenal glands. And by the way, the adrenal glands make a hormone called cortisol. Cortisol is a nice anti-inflammatory. Theanine is actually going to calm the brain by facilitating something called GABA. And then the Ganoderma is actually known to calm the body, the mind, and the spirit. And amazingly enough, all three of those are called out in the medical literature. So you can screenshot those PubMeds and look them up if you like. When we look at toxins, there's a lot of toxins on the planet. They're estimated to be responsible for 25% of all deaths on the planet. And the number one rule in toxicology is to separate yourself from the toxic source. But again, Ganoderma lucidum is proven to clear some of the worst toxins in the history of the planet. Those that can cause Parkinson's in a single dose, those that can cause liver failure in a single dose, those that can cause pancreatic failure in a single dose, and even those that cause neural tube defects in a single dose. And Ganoderma effectively neutralizes all of those. When we start looking at malnutrition, this is absolutely the biggest problem on planet Earth. The Global Nutrition Report says every single country on planet Earth has some form of malnutrition. And I have to wonder why malnutrition doesn't get more press, because it's the leading cause of death, estimated to be responsible for 60% of all deaths. So huge problem there. Simple math. Farmers found out, maybe 100 years ago that they could grow big plants with three elements: nitrogen, phosphorus, and potassium. And that use has gone up extensively, especially since around 1950. But it takes 30 elements to make healthy plants, animals, and humans. So what I tell people is if you pull 30 out for every 3 that you put back in, eventually you're going to have a problem. And that is where we are with this malnutrition issue. So it's estimated, this is US Department of Agriculture, that it takes 1,000 years to grow 1 inch of topsoil. And they estimate in the last 60 years, they've depleted about 60 inches. And CIA.gov says this is now a global problem. And in 2014, they estimated that if we don't change things, we're only going to have 60 years of farming left. So we want to all be conscious of renewing the planet nicely. When we start talking about malnutrition, I've created this nutrition pyramid in the early 2000s. And, the base of the pyramid is going to be food. If God made it, it's okay. If man made it, stay away. Then we go to superfoods. My favorite superfood, Ganoderma lucidum, very powerful at modulating the inflammatory process, and I'll share some information on that. There's functional foods, shakes and beverages, over 80,000 published medical studies on that, and over 3,300 studies on functional coffee. But these are food and beverages that have nutrients within them, like Ganoderma, that have a proven health benefit. A good multivitamin, multi-mineral, activated omega-3s, probiotics, and a combination of D3, K2. And this is what I recommend for everybody. And, the healthier you are, the less you need to supplement. But we know that everybody benefits and no one is harmed. This was a foot that originally hurt, but then when the nerves died, she couldn't feel anything. And then literally the circulation was compromised, gangrene set in. And she was scheduled to have that foot amputated 2 days from the time that picture was taken. But look at it 2 weeks later and ultimately 17 months later. And I will share with you then a little video of her in my office. And I say, I made a mistake on that video because I did it Facebook Live and the resolution isn't as good as I want. But maybe next time I see Maureen, I'll do a regular video. But I'm going to play that for you because it's a fun testimonial.
Let's get the camera work just right. If you look at my computer screen, we have this foot, and I can actually turn the image around, but that's February 3 of 2015. We had a pretty remarkable change just a few weeks later. And I have the beautiful owner of that foot, and that foot is more beautiful than ever. That's Maureen. Let's just see if I can get on that. And look at that. Look at how beautiful that foot is. And of course, look how beautiful you are. But tell me about, what we talked about earlier. So how are your blood sugars today? How are you feeling about life and your future? And
I feel better than I have in years. First of all, I feel more in control. of my diabetes, and I've been diabetic for 35 years. And what I finally realized is that the doctors have it wrong. You know, the diet that they tell you to follow, which is 45 to 60 grams of carbs a meal, is crazy. It sets you up for a roller coaster of highs and lows. And that's what I've been listening to for years. And I finally found a keto and low carb way of life that has completely changed things. I feel, what I tell people is I got off the roller coaster. You know, I got off the roller coaster.
And so now your sugars are the best they've been in God knows how long.
I don't remember. Yeah, I don't remember.
I mean, it might be 20, 30 years since they've been that good.
Yeah.
And even you had a conversation with your endocrinologist and you said, look, I want to get down to 5.0. And
she said, no. She said, no, it's too risky. It's too risky. And I said, why am I not entitled to the same blood sugars as a healthy person without diabetes? And she said, because you're not, you'll have too many hypos. In order to get that low, you would have too many hypos. And I said, what if I don't? And she said, okay, I challenge you to. And I said, challenge accepted.
well, good. You know what? And good for you. And thank you for inspiring the world. And one of the things I told Maureen, and by the way, if you can send some love and comments if this is inspiring to you and other people, I'm going to estimate that well over 1,000 people have had a phenomenal inspiration from Maureen to see what she was able to achieve with.
It's doable. You know, it's doable. Make your health the number one priority because it's life-changing.
And one of the things you said is one of the things we always have to have. You know, we're gonna have the best existence is
hope.
Hope is
Having
beautiful,
hope.
isn't it?
Yeah. You know, they took my hope away when they diagnosed me diabetic years ago. They told me, you're diabetic, you're gonna end up with complications. You don't have to. You don't have to.
Thank you for that. Do I have your permission to share this information with doctors, students, and patients everywhere?
Absolutely.
Any conditions?
Not at all.
One final look. Look how beautiful. Look how beautiful. Looks pretty much like the other one. Life is good.
Yes, it is.
Hey, let's get the camera work just right. If you look.
So, you know, what I simply like to tell people is, you know, if someone has a pulse, they have a prayer. It doesn't matter what the condition. And that foot wasn't removed yet. And so the dead cells, well, we couldn't recover those, but they were going to take the foot right there. And once they start amputating, that's usually the decline for the rest of the life. And Maureen's turned things around in such a really amazing way. So when you start looking at the complications of diabetes, when blood sugar is not well controlled, blindness, kidney failure, nerve damage, amputation, loss of circulation, heart attack, stroke, things like that, by regulating her sugar ideally, we're in good shape with that. And guess what? I put all those PubMed IDs there because every one of those shows that Ganoderma helps. Reishi, Ganoderma lucidum helps with all of those complications. When we start looking at the neuropathic pain like shingles, neuralgia, horrifically painful, Ganoderma beats any drug for that. Very, very powerful. In this study, people started getting pain relief quick. And near complete resolution at 10 days and no recurrence at a year, whereas medically they'd have about 12% recurrence. Ganoderma, this is a double-blind placebo-controlled trial on rheumatoid arthritis. It beats the pain relief of the top drug. Phenomenal for fibromyalgia. We've got a woman in the UK named Louise, 8 years on medical disability with horrific fibromyalgia, chronic fatigue, and other issues. Just started drinking Ganoderma coffee and within 6 months off of all of her drugs, off of medical disability and enjoying a thriving life. It can be absolutely phenomenal for migraines and the language is so powerful. I actually show the article, the International Journal of Pharmacy, Ganoderma lucidum completely proven to eradicate migraines without side effects in the majority of patients, which is very, very powerful there. It can even help the pain of things like chronic pancreatitis. So I noticed that there were some things in the chats. So let's see if anybody has any questions about anything.
Well, we are good to go. So number one, Delina asks, when you do the stress release, the reset, 7 to 10 days, do you completely stop after 7 to 10 days or would you slowly wind down the protocol?
Well, that's patient by patient. You know, some people feel so absolutely phenomenally brand new that they can stop and just go on with literally being reset and handling stress better and feeling better and controlling their inflammatory process and everything else. But most people I cut down to a few doses a day. and they like it that way.
Perfect. And Neil asks, what is it about nanoparticles in food that affects the microbiome and reasons why they put them in there?
Well, they shouldn't be in there. And I wonder if it was Neil that sent me the study or maybe Ralph sent me the study, but here's what they're finding is that they're very disruptive to the ecosystem. So these things are so tiny, they're disrupting the health and metabolism of the bugs in our gut. We have more bugs in our gut than we have cells in our body. Every bug eats, drinks, and goes to the bathroom. The difference between good bugs is bad is what they eat and what they poop. Good bugs eat poop and poop nutrients. That sounds kind of disgusting, but that's how our ecosystem works. Bad bugs eat nutrients and poop toxins, and these nanoparticles are promoting the bad and killing off the good. And for whatever reason, I think the world is going to wake up and ask, well, wait a minute, did you inject nanoparticles into me, and why did you do that, and where's the evidence that it's safe? And if they were to answer that, they'd say, well, there is no evidence that it's safe. In fact, there's actually plenty of evidence that it was harm, but this was an experiment. And by the way, you signed up for it. And by the way, if you die from it, you're not going to get a life insurance benefit because that's canceled when you sign up for a medical experiment. And plenty of people are having that issue around the globe now. So, we're hoping that a lot of people wake up. They need to, that's for sure. I think medicine's going to not survive as it is because so many doctors either can't think or choose not to. And either way, that's not acceptable when you're entrusted with people's care.
Okay, Claudio, we have a gap in the questions. Are you ready to go?
I am.
Go for it.
Is the CXT keto friendly?
Oh, absolutely. It's only got 4 calories. And so when you start looking at it, all organic, it's got the Ganoderma, it's got the lion's mane, it's got the cordyceps, it's got the green tea, it's got the theanine, it's got probiotics, even little caffeine buffered by the other calming nutrients. So, I think it's actually the best product that the company Organo has. Super smooth energy. It's a very mild flavor. I tend to like stronger flavors, but I put that in about 16 ounces of water, sip it all morning long, and it's beautiful for the brain, body, and everything in between.
Thank you for that. I knew that already. I relayed that information, but they wanted to hear it from you.
All right. There we have it.
Thank you.
Perfect. Next question. Larry says, thank you for all of this. What is your advice for the best protocol to approach for resolving leaky gut and rehabilitating sludge blood?
All right. So when it comes to leaky gut, probably to some degree, we all have it to a very, very minor degree. And I've got on my YouTube about the gut. And I think I specifically answered a question about GERD, and I put the gut protocol. But I tell people that the gut can be answered by basically 5 questions, and we can even ask sub questions to make it 7, because I like 7 questions. But number 1, what are you eating? And the sub question is how much and how often, because we know that calorie restriction and intermittent fasting are actually really, really, really good. And by the way, when it comes to what you're eating, simplest on the digestive system is 1 food per meal. We call those mono meals. Question number 2, and by the way, he asked that, do you have a leaky gut? And if you do, there's different tests for it, but we seal and heal it with things like colostrum, Ganoderma, vitamin D3, digestive support, and really good foods, and the amino acid glutamine. Those are super important to help seal and heal the gut. Next question, what kind of bugs live in your gut? Next question, how often do you poop? And then the final thing, how is your digestion? So that would be the 5 major questions and 2 minors, but glutamine, colostrum, vitamin D3, Ganoderma, monomeals, digestive support, all those things help to seal and heal the gut. And as far as the sludgy blood, well, that's a non-specific term. When I used to do dark field microscopy, we'd talk about sticky blood, and they'd even talk about rouleau, which is a French term for red cells in a row. Red cells should have a charge that keeps them separate, but when cells lose their charge, and there's a lot of reasons for that, being toxic, being way too acid, that can have an impact on those things, an inflammatory process. So ultimately, we have to figure out what's causing the sludge and clear it out. And it could be the big four: stress, toxins, malnutrition, physical inactivity. Address all of them. Now, what is significant and a very important parameter to know is, are people at a clotting risk? So there's lab values. It's called prothrombin time with international normalized ratio, or you might see it under the just the letters PT/RINR, prothrombin time, international normalized ratio. And you want to look at that and make sure that the blood's not clotting too much or too little. And I tell people, when they give drugs that prevent clotting, they actually prevent normal clotting and promote abnormal bleeding. But when they give things like Ganoderma, activated omega-3s, a good anti-inflammatory diet, they actually prevent abnormal clotting and allow, normal bleeding and clotting to occur. And those are essential functions.
Perfect. Next question. What could cause hives on back and chest itching worse at night?
Well, hives tend to be an allergy response. And, why is it not whole body? Why is it, just on the torso? Well, there's probably something more irritating in the torso where it's actually showing more. So, everything works together. So I had a fun physical exam instructor, Dr. Chapuis. He was from France, and he had this great accent. And when someone would have a pain or problem in an area, he'd look at the area and he would say, "Who lives there?" So if it's here and around here, well, is it the liver? Start going more to the backside. Is it the kidneys? Down here, is it the appendix? You start looking at the whole torso, you might start thinking that there's something digestive, something in the respiratory system, because those are the things that are going to be front and back with the greatest coverage of area.
Okay. Next question. Julie would like to know if you can repeat the best product as well as the life insurance policies not being paid.
Yeah, if someone takes an experimental drug and dies, their life insurance doesn't pay. Now, the censors are trying to block that, but there's a huge case in France where this multi-mega rich family that had bought a mega life insurance policy. The doctors talked the patriarch of the family to going in and getting the jab, and the jab killed them. And they all acknowledged that the jab killed them, and then the life insurance policy refused to pay, because you sign away your rights when you sign up for a medical experiment. Life insurance does not cover medical experiments. This is not a vaccine. It's not approved, and it's not even necessary. So even with the exaggerated deaths across the globe, this turns out to be an above average flu. There were plenty of effective treatments, well over 30 of them documented. Early treatment was critical. Doctors were blocked from getting effective therapies. So if you were to go on YouTube and look up Dana White talking about Joe Rogan being called public enemy number one, when Dana White, the owner of the UFC or president of the UFC, got COVID, he called Joe Rogan. He said, "Joe, what did you do?" Joe said, "I did ivermectin, I did monoclonal antibodies, I did IV vitamin C, I did zinc, I did vitamin D, and I was done with it in a matter of days." Dana White did the same thing. He was done with it in a matter of days. Well, they all got blasted, and then doctors started blocking the monoclonal antibodies. They started blocking effective therapies. They started blocking ivermectin. And Dana White said, "That's pure crap." He says, "I can go to 10 doctors and get opioid pain pills today, but if my mother was dying and I wanted to get her monoclonal antibodies, they're blocking that. If I wanted to get her ivermectin, they're blocking that. And these are profoundly safe and effective medications." So he said, something's very wrong here. And all you need to do is just have one eye partially open to see the wrong. It's so wrong and so obvious. And we all need to stand together. I'm proud of Canada for their stance.
We try. Okay, next question. Any information on scleritis? I know someone who has both eyes currently infected. Evidently, this happens periodically for this person.
Well, if it's infected, we got to pick up the immune system. And so keep in mind, the eye's a little challenging because the circulation is slightly compromised. And that's why they tend to treat it with eye drops rather than systemic. But we want to pick up everything. We want to pick up the health of the eyes. And by the way, diabetes is really bad for the eyes. Anything that would even compromise circulation would be a problem there. So we want to find out what the systemic health issue is, why there's a compromised immune system. And this might be someone that would benefit from a healthy eye drop. There was a time when I could get, liquid vitamin C, and I would make patients a very dilute eye drop of vitamin C and put in a little bit of normal saline, and that can be pretty powerful. So there should be some healthy eye drops available, even if you have to get it through a compounding pharmacist. But, work from the health inside out to make that better.
Okay. Delina, you have a question?
Hey, Dr. Bob, I appreciate you always.
Happy, beautiful evening. Back at you.
Thank you. I have a couple of new people on this call and receiving a few text messages. So some of them are hearing the protocol for the first time, and that's your standard protocol of the 2 spores, the theanine and the melatonin. And so from their research, looking on the back of the bottles, it says to take one a day. And so they're concerned that this is harmful with taking this every hour when the bottle is saying 1 a day.
Well, the bottle has to say something, right? And when you start looking at it, you go and you realize that there's no known toxicity, no known drug interaction. But, someone asked me, could it potentially be toxic? And the answer is, of course, it could be. And so my running joke and an example, which is very, very accurate, is, I'll ask people, well, who here wants to learn how water can be toxic? And someone will raise their hand and I'll say, okay, good. We're going to go to my backyard in my swimming pool and you dive in the deep end and you drink water for 12 minutes and you're going to find out how toxic water is. Now, I can swim very strong. I don't mind the cold. I'm certified in CPR. So I'm not too worried about that. If we get you out in time, we can bring you back. But that's about the same with Ganoderma. So they don't do human toxicology studies, but they did do dogs, and they took 100-pound dogs and they infused them with the equivalent of 4,000 doses a day, every day for weeks on end without any toxic symptoms. Now that's a 100-pound dog. So what I would simply tell them is there's 90 counts spores in the bottle. So you could take, 44 bottles of spores every day for weeks on end without toxicity. We're not asking you to do that. If you're awake 16 hours, you'll take 32 spores. And by the way, I've had, tiny humans do this only to report that their life is so much better. So when you start looking at the poison control database, and I review that when I go in, I teach my nutrition lectures, guess how many people have died in the last decade of vitamin, mineral, natural product overdoses in the entire poison control database. And we can all name them by name and with the correct spelling because it's absolutely nobody. So, and the last people that did die died from tainted samples. So, these natural molecules are profoundly safe. Now, that's not true of everything from nature. There are some medicinal herbs that are risky, but Ganoderma is a superfood. You'd be a lot more likely to overdose on chocolate, and I mean that in all sincerity, because that can cause a lot of people problems. Maybe not the chocolate itself, that's a superfood, but once they start putting a little sugar in it, people can do a lot of that. Ganoderma is profoundly safe and effective. Pregnant women can and should take it, and that's the same with nursing moms as well.
Okay, perfect. All right. Marie asks, what do you recommend is the best protocol for someone who has low bone density?
Well, one thing that people need to understand is when they start doing these bone density studies, they're going to take a petite female and they're going to compare her to a 35-year-old Amazon. And I've yet to see a single petite female not told that they have at least osteopenia after subjecting to that procedure, which, by the way, is radiation, right? DEXA, dual energy X-ray absorptiometry. So, why are you submitting your body to that? But bone is not just calcium. It's at least a dozen different minerals. There's a protein matrix. There's a hormone component to it. And there's a weight-bearing component to it. And so people should exercise. If we start talking about hormones, And that's going to be our topic next week, by the way. And it's just a little precursor here. Just because a woman turns 52 and her ovaries no longer have eggs and she's not ovulating or menstruating, that doesn't mean that she's no longer making estrogens, androgens, or progestins. There's a term called intrachronology. The cells that need the estrogens, the androgens, and the progestins, they all make it right then and there. They use it there. They detoxify it there. And world-renowned, endocrinologists will tell you that looking at the blood to try to figure out what's going on in the tissue is ludicrous. It doesn't make any sense. You want to look at everything going on with every body, and especially the cells of interest. But when it comes to bone thinning, that's going to happen to all of us as we age. We can slow it down with good nutrition, by maintaining acid-alkaline balance, by monitoring and buffering our stress, by getting good night's sleep, by getting good weight-bearing exercise. And very, very simply, I like people to put on a heavy vest, go for a walk, maybe do some squats, carry some weights in their arms, do some curls. They don't have to be heavy. It could be a can of peas, but a little weight is better than none. And just be careful of what you're being compared to. A lot of the numbers that are out there are created to put people on drugs. And I think people are going to take a deeper look at all this stuff soon.
Perfect. And what would your protocol or suggestion be for someone who has low hemoglobin levels?
We want to figure out what's causing it. If it's just plain diet, well, okay, let's get some good quality irons. And when, we teach about vegetarianism, I'm a big fan of plants. Plants have a lot of health benefits. They don't concentrate the toxins. People that eat the most fruits and vegetables get the least cancer. People that eat the least get the most. So there's a lot of benefits there. But one of the challenges with plants is a bioavailable iron that can make hemoglobin substantial. And iron is the most common global deficiency. And some of that is estrogen toxic. So it's estimated every man, woman, child, plant, and animal is estrogen toxic because of these chemicals, estrogens in plastics, pesticides injected into animals that are universal in the environment. And so heavy menstrual flow is a common cause of blood loss, anemia in young females. So is it diet? Is it blood loss? Is it internal bleeding? Is it a combination of all the above? We need to figure out what's causing the problem and resolve it.
Okay. Liz asks for overall health with Ganoderma spores. There we go. How many and how often would be a good protocol for the average person?
Well, it might be zero. So when you start talking about Ganoderma, the magic of having a delivery system like coffee and tea, I don't take spores every day. I don't take capsules every day in terms of Ganoderma because I get, half a dozen plus doses of either coffee or tea or CXT, and that ought to hit that superfood requirement for me. But, it's going to be person by person dependent. I would think for most people, a couple a day would be wonderful and health enhancing. But if you're under more stress, big exercise load, exposed to extra toxins, things like that, I would increase the dose, to match whatever you need to feel good as much as possible.
Okay. Perfect. All right. Liz would like to know how different is QI mushroom red reishi extract compared to Ganoderma.
Well, ours is the premium, so I mean, if it's USDA certified organic and, has the same quality certifications, which I haven't found in any company, it might be comparable. But one of the things you want to see is, does this company have spores? Because that means their plants are healthy enough to reproduce. And most companies, they grow their plants in plastic bags and they're not healthy enough to reproduce. And even if they do have spores, we have a patented process by which we get 99.9% nutrient bioavailability. And the next closest competitor had 15%. So if you want the absolute best, well, we have that. If you want to take a chance on something less, well, you're free to do that. I don't recommend it. We have seen such great success with this across the globe now, just from our experience in a decade. And really, you start looking at humanity, you go back 5,000 years of documented safety and efficacy of this amazing plant. And that's why it's the consensus top superfood. So if you have readily available the best source, why look anywhere else?
Okay. How many CXTs do you drink daily?
I'm going to say I probably have 10 a week. I'm pretty sure I have one every day, and then some days I have two. Today was a 2 CXT day. I got up early. Today's my long day. I even have a Zoom after this. So a couple of CXTs and many delicious coffees, and I still have some OGX, so I had some of that as well.
Awesome. Well, that's the end of the questions in the chat. So I think Claudio has a question for us to wrap us up, so you've got time for your next Zoom.
Yay, I won't keep it long. So I've never heard of Kawasaki. I believe it's Kawasaki syndrome. I have a colleague at work that's got a 12-year-old. I ride a Kawasaki, but I'm not sure why they named it after my motorcycle. But if you can elaborate, that would be awesome, please, and thank you.
Yeah, if we were to go and look up the cause, it's like a blood vessel disease, and they're not really sure of the cause, but they suspect it's autoimmune. And I tell people, in medical diagnostics, they have these diagnostic codes. And there was something like 14,739 diagnostic codes in the 9th version of the International Codes of Diagnostics. And when they went to ICD-10, they increased the number of diagnoses by over 55,000 new diagnoses. So not every week, but let's say for sure a couple times every month, someone names a disease that I've never heard of. And so what I'll do, Claudio, is I'll just go like DuckDuckGo. We don't do Google anymore because they censor, but go DuckDuckGo Kawasaki etiology. And what will you find? Well, etiology unknown, suspected autoimmune, or that's what it was the last time I looked at it. And so I've got a YouTube video on, what do we do for autoimmune and how do we regulate and modulate the immune system? 6 universal immune modulators that I'm aware of that I consistently use to get great responses. One of those is Ganoderma, and others is a Chinese botanical called Periliseed. We talk about sealing and healing the gut. Some references say that if you seal and heal the gut, that can be sufficient to eradicate autoimmune in many, many cases. The activated omega-3s, vitamin D3, and then the adrenal precursor, DHEA. All of those are known modulators. And, we want to modulate the immune system, calm this thing down and make it go away.
Perfect. I believe that would be the last one for you for this evening.
All right. Well, then
Thanks,
I'll wrap up. As I wrap up, I'm Dr. Bob Rakowski, absolutely knowing that we can all be happy, healthy, and successful. So good night, all.
Amen.
Feel free.
Thank you, Dr. Bob.
Love and appreciate you. Thanks,
Thank
Carol.
you.
Dr.